Hello, everyone. My name is Cassandra Howell, and I'm the Chief Operating Officer with Public Health Solutions. Here with me today is Sandra Clark, the Director for our Sexual Reproductive Health Centers. We also have our Managing Director, Murray McLean, who is here. Thank you, Murray. Also, we have our Chief People Officer, Jamar Ward. I want to first acknowledge everyone who came out today, and I want to say thank you for all of you who came out in person, and then also for the individuals who are joining us remotely. Today's announcement is very important, and it carries a lot of emotional weight for PHS, for its partners, and for the community here in Brooklyn. I want to emphasize that this decision was not an easy one, and we underwent exhaustive efforts to try to maintain our centers and to keep them open. We are here today to inform the Brooklyn community that Public Health Solutions will be closing its Fort Greene and Brownsville sexual reproductive health centers. The phased closure has started with the suspension of new patient admissions for our family planning effective January 7th, 2025. All clinic services will phase out by March 2025, and all operations will cease by April 2025, pending approval from New York State Department of Health. I want to acknowledge the representatives here today from Sun River Health and Community Health Networks, along with other local organizations who are working closely as partners with PHS for patient referrals. The decision to close our centers was driven by significant challenges that made continued operations unsustainable. We experienced the persistent vacancy of a medical director. It was difficult staffing for positions such as nurses and other providers. We experienced rising operational and laboratory service costs. We were unable to negotiate fair rates with managed care organizations. We had not been able to recover our outpatient volume to the pre-pandemic rates that we were seeing, coupled with a sharp increase in uninsured patients that grew from 15% to 30%. Inadequate funding from Title X and state family planning partners, compounded by significant, insufficient fee-for-service revenues, all contributed to this decision. All of these financial strains of operating two small centers without economies of scale has led us to this decision today. Ensuring the continuity of care for our patients is a top priority. A comprehensive list of alternative service providers has been developed and is being shared with all of our patients. Support will also be available for patients to access their medical records securely. As an organization, we want to take a moment to give thanks and gratitude as we recognize the vital role that these centers have played, serving Brooklyn residents for decades. I want to express a deep gratitude to our staff for their dedicated compassion, commitment, and high-quality care, and of the community for being our trusted partners throughout our tenure here in Brooklyn. PHS remains committed to advancing health equity, and we will continue to collaborate with community partners to address the needs of underserved participants, populations in Brooklyn and beyond. Thank you for being present here today, and we do want to open it up for any questions. I think we'll go to Media Live. Do we have anyone online with questions? No online questions.
Thank you for putting this together. My name is Justin Freeman. I'm the director. Oh, wow. Hello, good evening. My name is Justin Freeman. I'm the Director of Community Affairs for Assemblymember Forrest. It includes Fort Greene, Clinton Hill, Bed-Stuy, and Crown Heights. What I guess I wanted to ask was if you can share what is being lost, like the connection with the community and the different kinds of services that were provided.
So our sexual reproductive health centers provided contraception care, prenatal care, STI testing, GYN services, medication abortion, and a robust sexual reproductive health education and contraceptive counseling. So those are the services that we provide. And in 2024, we administered over 6,800 appointments. Thank you for your question.
Hello, my name is Lua Dibble, and it's a comment, not a question. I just wanted to say thank you so much. Your services helped me so much, and the staff were so kind and so helpful, and they gave me excellent advice, and they even got me health insurance, so I'm so appreciative of that.
Thank you so much.
Thank you.
Yes. We have a question from the live. Go ahead.
This question reads, I got the message from PHS about the closing, but no info on where we can get services now.
So that information will be sent out via email and via text after this public meeting. We will be sending personalized information to our patients, and it'll be a blast to everyone.
And there's another question from the live also. Will the MyChart records still be accessible?
Yes, there will be a point where we will continue to have the charts open for our patients. They have a portal that they can go to, and they will continue to have that portal for now, yes.
And just to add, for the alternatives of other providers, there's about 16 other alternative providers that will be able to provide services in family planning and just another wide range of services. So we have a handout here that we will make sure to put online as a PDF so people can receive it.
Mm-hmm.
One of your questions was how PHS will continue to provide services in Brooklyn. And I don't know how many of you know that we are part of the Social Care Network through the Medicaid waiver, 1115 waiver. So we will be providing a host of services with about 200 partners. So it's not like PHS is going away.
Yes.
We are here to stay. We are committed to Brooklyn, and we are not going to go away, and we're not going to leave this community alone.
Yes, thank you for that, Ivy. And it's not secure yet, but we've made some really good discussions today at our Brownsville location with renewing our lease there, but conducting social care network services. So we're really excited to keep that footprint. Any other questions?
Hi there, for the folks online. I wanted to just address a question regarding other alternative services and other providers. And we actually have a handout here that lists about 16 providers, some of them that provide the full suite of sexual and reproductive health services, and others that provide family planning services, and others that provide a broad range of services. So we'll make sure to put this online and so that it's available for everybody. Okay.
And for some of those other organizations, we have partnered with them in order to make sure there is continuity of care for all of our patients.
What can be done?
All right, any other questions before we close?
Yeah, it's a broad question.
The question is, what can be done by the community to make sure these 2 locations remain open?
You know, with any administration, right, there are changes. So whether it's a Democratic or Republican, we know that there are going to be changes. None of us know what those changes are, right? We prepare for the worst and expect the best, and we know that we're committed to providing these services. So whatever any administration puts forward, we're gonna make sure that we're here. And that's what we all have to commit to.
Yeah.
There are a few more questions on the live.
Okay.
The first one is, how can we prevent this from happening again to other community partners?
Awareness, right? I think it's really important that we, Black and brown people in underserved communities, really take advantage of the healthcare options that we have. I think a lot of people are not sure of where they can find services, how to get services. I think nonprofits and other partners in this space can continue to do a little bit more outreach. It is important, and we have a testament here today for someone who was enrolled into healthcare and it has changed their life. This is real. Healthcare is important.
The second question is, are we able to make an appointment before you officially close?
So we are not taking any more new patients. However, if you're an existing patient, you can still continue to make follow-up appointments.
And the third question is, are they going to be the same nurses at the other clinics?
Unfortunately, we are working hard to try to make sure that the nurses who are at PHS are able to kind of transition to other places, but there are no guarantees of where they will be going.
But we can say that some of our trusted partners in this room that I named earlier have said that they have vacancies. So we will definitely be making referrals.
Right.
Any other questions or comments? Oh, one thing. Did we mention the job fair?
We
PHS.
didn't. We
Okay.
didn't.
Yeah.
So
I think it would be important for folks to know. It's awful. We want to make sure that we take care of our team, because these are our team members. And I'll just turn it over to Cassandra to just give a little more detail about all the steps that we've taken to ensure that folks are supported.
And a lot of them are in the room here today. So thank you for being here. So when we made the decision to close our sexual reproductive health centers, we also realized that we have embarked on a very large project, the Social Care Network and the 1115 waiver. This is allowing for us to transition, of course, qualified employees who are interested in staying with PHS and moving over into different roles. And as of yesterday, we had our first offer that was accepted by one of these employees. So we're super excited to keep as many employees that have been impacted as much as possible. And also, I would say, yes, we had a job fair, and that job fair included resume building, interview help and preparation as well. All right. I want to thank everyone for coming out. I want to thank everyone who joined us live. Have a good evening.
Thank you, everyone.